Thank you. Thank you for joining me today. I'm so excited to speak with Health Coach Shaundra Brown and learn how health coaches can help us optimize our wellness. So, how can a health coach help us reach our wellness goals?
Thank you, Dr. Evans. So glad to be here. Thank you for the question. As a health and wellness coach, I love just being creative and being able to work with folks individually. We're all so different in how we move, what we like to eat, what we don't like to eat, what motivates us and inspires us, and where we like to practice self-care. So as a health and wellness coach, I just like to meet my clients where they are, give some inspiration, and really partner with them to meet new goals. Accountability is key. Having somebody in your corner that's going to ask you how you're doing and follow up with you is so important in the health and wellness coaching process.
Yes, thank you. That when you spoke of partnership, I can certainly understand. I can certainly relate because as a physician, it's so nice to partner with other healthcare professionals, and that helps us partner with the patients that we care for, the clients that we care for. And I kind of just jumped right in because I know you. But now, like, let me give you an opportunity to introduce yourself.
Well, my name is Shaundra Brown, and I'm a holistic health coach. And what that means is looking at all of our health and wellness components from the whole spectrum. So a lot of times people think of a health coach and they think, okay, physical trainer, drop and give me 20. Or they think of a nutritionist. Here's your meal plan. You have to eat this amount of calories and this amount of carbs, and this is your daily intake. I do not subscribe to all of those very specific rules, but I incorporate all of it. So I love the holistic journey that I am on personally because it allows me to really connect with folks as they're going through their health journey. And we can talk about joy, spirituality, creativity, what's going on with your finances, your relationships, career, education, what's going on in your environment with all of this hybrid virtual, but we're going back into spaces, that brings up a lot of emotions and thoughts and feelings that then will impact what we eat, how we move, and how we maintain our stress levels and our health. So I like to look at all these dimensions and really help us focus on holistically the things that are happening with us that impact our health.
That's awesome. That was very good distinction as to what sets your services or what your skill set sets apart from. So that's, thank you. Thank you.
You're welcome. I'm at work and I'm on my computer, and then the phone rings, and then somebody walks in the door, or the Zoom chimes, or I know I've got to move what I'm doing and get into the Zoom meeting. And all of these things are happening in my work life. And I have this constant circle of a deadline. I've got a report, I've got a meeting, I've got a presentation. So I've got this pressure or stress, work stress, productivity stress, but all the same, I have a deadline, and all of these things are just hitting me and coming in, and it's creating some stress. So the first thing that I talk about for myself and for those that I partner with is let's just stop. The first step is just stop and acknowledge it. How many times are we super women, or I'm the super employee, and we just go. We look up, we didn't have lunch. We didn't get out of our chair to stand and stretch and take a deep breath because we're so pressed to meet our deadlines. So the first thing I say, Dr. Evans, is just stop. Recognize what's coming up for me, what my thoughts are, what my feelings are, what my body is telling me. Maybe I'm holding tension in my neck and shoulders. Maybe I'm starting to get a headache or fatigue. So really recognize and then take a breath. I'll talk more about self-care later, but take a breath. It's so important for us to just connect with what's going on, acknowledge it before we then start to move differently and address it.
Your coaching is very effective. As you were talking, I was like, stop. Awesome.
We'll do breath exercises. I love it. Even tapping. We'll get to tapping too. I love doing those hands-on activities.
So, what is your favorite self-care activity to coach on?
Wow. I love this idea of emotional freedom technique. earlier you asked, well, what's a good way to kind of tap into our emotions and use that in a positive way on our health and wellness journey? There's this thing called EFT, or tapping. And I had never heard about it growing up. I had never heard about it in school, hadn't heard it from previous doctors or coaches or nutritionists. And I was like, what is EFT? EFT, Emotional Freedom Technique. And the nickname is called tapping. And it's based on, similar to acupuncture, you have meridian points or pressure points through your body that connect to your bloodstream, connect to your nervous system, connect emotionally to your memories. Your body holds on to, the body never lies, right? We hold on to memories, and there's all this metaphysical research that, we hold it on in our cells and our body makeup. So EFT, or tapping, it is 9 different pressure points that you actually talk through an emotional question or something that you are dealing with, and you actually tap through 9 different points. There's a couple that I didn't touch on, and you actually release the emotion or the stress or the negativity or the feeling, and you bring in positive affirmations, positive self-talk, which we don't do very often. I know I can say, oh, I shoulda, I woulda, I coulda, but the positive talk, I am taking time for myself today. I went on a walk today. I drank 64 ounces of water today. So really reversing the negatives and building in the positive with a physical connection to increase your blood flow and to increase that movement physically and emotionally through your body.
It's
Yes,
interesting. Yes, thank you. One of my favorite things I started saying recently is that I'm not going to should myself, but you bring up a good point. Now I have to replace it with the I ams and then move it through my body. Okay, very, very good. And also something else that stands out, it seems like it's something that we can do anywhere, anytime with no equipment.
So migraines, you can use, I should also say, for tapping, you can use it for physical pain or emotional memories, emotional blocks. But migraines, intense pressure, sinus headaches, I used to have them a lot. And so you would see me doing this at a stoplight or in my car or even at the grocery store. I pick one point. So I'm not going to do all 9 and say things out loud, but I'm just saying to myself, I'm not stressed. I'm taking a deep breath. It's going to be okay. Release the tension, release the pain. So I am saying a couple of things to myself and maybe just picking one. They're like, oh, she's tapping on her forehead. I use tapping anywhere all the time, but I also work with clients to say, even if you're in a public facing business, you have breaks from work, you can go to the bathroom, you can step outside, you can step into your car when it's not hot, but you can craft a little 5 or 10 minute you time to do some tapping and find some relief, even during the middle of your workday.
Oh, yes, very good point. One of your posts that says, my own self-care is priority to me. Any tips on helping us prioritize our self-care? You did mention some workplace things we can do, but any additional tips?
Look, Dr. Evans, we are busy career women. So many of us are busy at home, busy at work, busy at church, busy in our communities, in our social service organizations, and in our workplace. And so we do it all. Yes. And I will echo our First Lady, Michelle Obama, when she says, putting yourself first is okay.
Oh, yes.
It is so essential for us to be number 1 on our own to-do lists because nobody will do it for us. So I've taken that into my own interpretation. I want to fill my teacup first so that I have so much more to give others. So if I'm well, if I'm starting my day, or even in the middle of the day, if I need a boost, if I do something for me, after school homework, pickup, soccer runs, grocery store, meeting clients, I have so much more to give those other spaces when I am well, first and foremost. So I put myself on my calendar unapologetically, Dr. Evans. I make an appointment with a reminder. So let's say I'm doing a new physical activity, and right now I'm doing swimming in the morning. Now that I can do it during summertime, I can do it at 9:30 a.m. It's that hot here, and the kids aren't in the pool yet. They don't come until after lunchtime. So it's great. I set it on my calendar and it does two things. It stops somebody from scheduling a meeting with me because it will bump it out that I'm not available. And they'll say, wow, she's got that hour for her. So everyone's schedule is different. It could be a late afternoon, evening walk after dinner. It could be just time in your quiet space where you just have some really nice chill music on and you just really just be mindful, just thankful for the day and just have your own quiet time. But really finding that appointment that works for you, put it on your calendar, schedule yourself first. That's so important. So important.
I like that.
And that's
first.
going to be there, cooking dinner and prepping. And I'm thinking of my to-do list. It's going to be there. I'm going to be able to start the day and do my to-do list. Sometimes I've got to get up and do something super early to have my me time. And I can't swim that day because I've got an all day commitment or several things coming. So I'm like, okay, I have to move this appointment to the next day, but I'm still going to do, if it's not that swim block, I'm still going to do something for myself that day. Even if I have to give up that time, I have to swap some time back out for me.
Yes. I often say something along the lines, self-care is not selfish, it's strategy. And so, yes, it's something that all of us need to be reminded of. So I think there is a conditioning. If we serve, we're, doing well. But as you stated, we need to fill up in order to give people out of our overflow, out of our abundance. So thank you. What inspired your journey to become a health coach? And how long have you been on the journey?
So, wow. I was formerly a classroom teacher and then worked on college campuses, leading student activities, student government, student life. And I was very active. I was walking around, I was on the move. And later in my career, I transitioned into a desk job. So I don't know if anyone watching can relate to this, but you know how they say the freshman 15, and then I think with our pandemic, we said the COVID 30, right? Different habits, more sedentary, not walking around and being as active. Well, I sat down at the desk too long. Have you ever heard sitting is the new smoking?
Yes.
Sitting is the new smoking. Dr. Evans, like your body just compresses everything and doesn't move your blood flow all around. And I started to have personal health consequences as a result of 10 years of sitting at a desk. It is real, y'all. It is real.
Yes.
And very honestly, my health journey is so important. I'm always transparent about this. I have type 2 diabetes. So weight gain led to all of those medical changes in my health. And so I was on this personal journey to do something a little bit different. How can I better my own health and my friends and family around me? So during the desk job, I thought about a holistic coaching program. Ironically, it's online. So I was at the computer even more so, but they give you lots of modality while you're going through the online course. So I was on a personal journey just to really interrupt some of the bad habits that I had developed and really incorporate work life with my own health. And then I got really inspired during the pandemic to make this my full-time approach and really say, okay, now I'm certified through the Institute of Integrative Nutrition, and now I'm ready to reach out and help others. And so if folks really like my coaching style, Dr. Evans, because I'm a real person, right? I'm not perfect. I don't have it all together. I'm still on my journey, and it becomes like a partnership for us to share ideas and encourage each other.
Yeah, you sharing your story is very helpful, encouraging, and inspiring. So thank you for doing that. And it's helpful for people to look and see that you're not only talking, you're walking the walk and you're walking it with them. Mm-hmm. And that makes the partnership so much more powerful. So thank you. Thank you for showing us, a glimpse into what you're going through and what you're overcoming and how you're doing that. So many of us need healthy emotional comfort. What is your go-to practice?
Not to eat my feelings, but food, it can be a celebration and it can still be very social. So an emotional craving that I had, that many of us had, if you will, during the pandemic, especially early in the pandemic when we were on quarantine, I still wanted to have that co-cooking and co-dining experience.
Yes.
You just had to do it in a virtual way, right, Dr. Evans?
Yeah.
So I kind of researched this health challenge, of different fruits and vegetables, and did a plant-based challenge with my friends, and
Yes.
just encouraged us all to just jump on Google, find out different recipes with the foods that we loved, but this time without meat, without
Mhm.
boxed, packaged, prepared foods. It had to all be fresh. So it was plant-based and no processed foods. And we did it for 10 days. And we really had to come together to support one another, because
Yes.
that's not how you operate now, especially now that we're back in our cars and there's the drive-throughs and there's the
Yes.
convenience foods, and like, I worked late, I want that salty or sweet craving. So it was so important during that emotional response of, oh, I want my people, my folks, I just need that virtual hug, but that we were actually doing something new together that we hadn't tried before. So we had a lot of emotional support to have fun cooking, eating celebrations virtually. And we tried something new. And some of us still use that plant-based, maybe not vegan, but definitely adding more plants in
Mhm.
to our diets and to our nutrition.
You speaking of that experience sparked a question about your practice. Do you often lead groups, individuals, both? So when you're a health coach, what is your
Yeah, Dr. Evans, there's definitely all three levels. So I often partner with doctors, physicians such as yourself. And so clients may want to go deeper after they get that workup,
Yes.
after leaving their yearly physical. What's the plan? What am I going to do? Because I'm going to report back to my doctor in 3 to 6 months.
Yes.
What measured gets changed, as you taught
Yes.
me. And so how am I measuring and progressing through my health, getting better? What do I do? This is the worksheet that says this is what I need to do. How do I do it? So I work with folks individually who are ready to make that lifestyle change. I also really love to work with groups, more in numbers, more support in numbers. So church groups, friend groups, work groups, sorority, fraternity groups, family groups. Families are fun because they have that built in, either support each other around the mealtime, or somebody's bringing something in and you're like, wait, that's not on the plan. So I love working with families, and it's fun teaching kids and teenagers so that they're building life skills with their parents. And then I also do corporate health and wellness coaching. So I can also go organization wide at a school district, at a corporation, at an office.
It's exciting. Any final tips?
Yes, Dr. Evans, self-care is a practice, right? It's something that we practice. We don't have perfection. We don't have to be experts. So I say, make it creative and make it fun. Try something new. So tapping, when I first started tapping, I didn't know where to go next without looking at a piece of paper or without following a video, right?
Yes.
While I was learning it. And even if I missed a point or I went backwards, I was still getting the benefit of tapping in and really connecting with me. So try something new and be creative. Mix it up. So it's swimming right now in June and July. By December, I'll be mixing it up and trying something, a YouTube video or a Zumba class indoors online. Like, mix it up and really do something different. And the other thing, Dr. Evans, I always grew up with the idea of self-care was, remember that commercial, I'm dating myself, Calgon, Take Me Away, in the bubble bath, and the mom
Yes.
closes the door and the kids are trying to say, no, it's my time. Self-care does not have to be this large hour block. They could be little 5-10 minute refreshers during the day so that you can sustain yourself to go into that next big block that's on your to-do list. Take a 5-minute, 10-minute space for you to re-energize and recenter as you come back in to doing the other things for others. So those are my tips for self-care. Mix it up and feel free to spread it out throughout the day. It doesn't have to be one large block all the time.
I think that's really helpful because a lot of people don't feel in charge of their time.
Mm.
They have to work during these hours. They have to do this during these hours. But if we allow ourselves, if we create the space for 5 minutes here, 2 minutes there, a 30-second deep breath, whatever it is, that can help us start to increase our sense of self-efficacy to make the change in these little, there's a saying, Moments build momentum.
Ooh, I love that. I love
Yes. And
that.
then before long, yes.
Yeah. And let's add the endorphins to that. So
Oh, yes.
medically speaking, the endorphins, the serotonin, the feel-good hormones
Oh,
that you
yes.
get just from the deep breaths alone, or
Yes.
just from the silence and blocking things out for a few minutes. There is really a physical, biological reaction to your self-care when you tap in.
It's out here changing the world with these little tips.
One deep breath at a time.
Yeah. I want to create a space for you to share anything else that's on your mind, or anything you want to leave us with.
Just to really honor yourself and
Mm-hmm.
acknowledge and be in touch with what comes up. You are unique and special in every way. There's only one you. So the self-care is so essential to continuing to be your best, be well, and find joy.
Oh, thank you, Health Coach Shaundra Brown. Thank you. I really enjoyed our conversation today. And it's been helpful for me because I've been knowing you for a few years, but this has opened up so many other ideas in my mind in ways that your services can benefit me as an individual, and as a busy person, because, we all need that encouragement. We all need that guidance, and we're all on this journey together. So thank you.
You're welcome. And it's so much more fun in community.
Oh,
And
yes.
so I'm so grateful to be part of your network. And I'm so inspired when I see you on Instagram and you have different challenges where you're pushing us to really address what's coming up in our health and not run from it, but really lean in so that we can live healthy. So
Oh,
thank you
yes.
also for inspiring
Oh,
me to be in my best health.
thank you. Thank you. Well, thank you for joining us today, as you've learned how doctors and health coaches can work in partnership to help you reach your wellness goals. And we hope that you found value and that you continue to connect with us on social media.